Welcome to week 18 of the Mama Stay Fit Pregnancy Week by Week Update. In this video, we're going to explain what is going on with your baby this week, what you can expect for yourself, and then also how I am feeling in my 18th week of pregnancy because I'm on this journey with you. So if you're pregnant, be sure to comment below to let us know how you are feeling because we would love to connect with you on this journey. So Roxanne, what can we expect for baby during week 18 of pregnancy?
So baby in the 18th week is the size of either a bell pepper or cucumber. I don't know how they're the same, but that's some vegetable if you like that reference. Or a Nintendo NES or NES, whichever, I don't really know how you say it, but that controller. I think it's a kind of a smaller controller. So that's
probably the size of a cucumber.
It's probably the size of a cucumber or a bell pepper, depending again on which app you're using. During the 18th week of pregnancy, your baby's hearing is starting to develop further. So as the week progresses, your baby is able to hear you a little bit better. So continue singing and reading or talking to baby however you're choosing to talk to them. Baby's nervous system is also continuing to develop, especially the motor portion of that nervous system development. So baby is able to move a little bit more. You might notice some flips. You might notice some kicks or jabs with baby. Baby is still a little bit smaller where you may not be feeling a ton of movement, but know that baby is doing like gymnastics in your belly at this point. So Gina, have you been feeling your baby move this week?
I have been. She's been kicking a little bit, but there's no pattern to it, and I can't feel it if I put my hand against my belly as much as I want to. And so, yeah, but I've been feeling her move. And so what's really cool is if you exercise throughout your pregnancy, it can also further develop baby's nervous system as well. And so the stimulus from exercise is helping to build new neural pathways for baby, which is helping to develop their nervous system a little bit more. And so when they're born, the first year of life, they have more cognitive skills, they have more motor skills, and they also have more language skills, which is really cool, thanks to working out during pregnancy. So in my 18th week of pregnancy, I'm still trying to stay as active as I can, trying to lift weights, do cardio, so I can really help with my baby's nervous system development as well.
So what else is happening to your baby is your baby's lungs are starting to develop. Within their lungs, there are little branches called bronchioles, and these are starting to branch out and develop as your baby is growing within this week, so that when they're born, they're able to take those big, deep breaths. This is also the time that you can start getting your anatomy scan. Week 18 is the earliest that they'll offer it to you, so you might be able to see baby at your next prenatal visit. On the anatomy scan, the most common thing that people are excited about seeing, other than just seeing their baby, is the sex of baby. So if you're not wanting to know the sex of your baby, this would be important to let your provider know and let the ultrasound tech know that you're not wanting to know the gender so they don't announce it to you during your anatomy scan. What to expect for you during week 18 is you might start noticing that your feet are starting to swell. And again, this is just due to the change in the amount of fluid that we're holding on to during pregnancy. We have an increased amount of blood volume as well as different fluids in our body that might lead to swelling in our legs and our feet and even our hands. And this is due to, again, that fluid, but also a little bit with our hormones. So we might also notice dry eyes, which also is due to our hormones. So you might notice that all of a sudden, you didn't have dry eyes before, but now you're really itchy, or you might need to apply eye drops because of that dry eye. And this just happens during pregnancy due to those hormonal changes. We might also notice that we're starting to have an increase in our appetite, especially first trimester. Most of these symptoms are gone, and you might start feeling like you're hungry a lot more often throughout the day and requiring more snacks throughout the day. But when you sit down for a meal, baby is starting to get a little bit bigger where you may not be able to have a full meal like you used to outside of pregnancy. So you might need to have more frequent, smaller meals at this point. Your sense of balance might also be a little bit altered because of the changes in your pregnancy where you might feel almost unstable when you're walking at sometimes. And this is due to the change in our gravity. As our belly starts to grow, our center of gravity is adjusting to what it normally is outside of pregnancy. And this could lead to your body needing some adjustment and a little bit more unstable in our gait. And then the last thing that might happen during week 18 is our blood pressure is changing. During the first trimester, you might have noticed that your blood pressure was lower than it normally is. And this is due to our blood vessels expanding, but our blood volume had not yet caught up. So this causes our blood pressure to decrease because we didn't have enough of the fluid within our blood vessels to accommodate that dilation of the blood vessels. But now in week 18, our blood volume has pretty much caught up to the amount of those blood vessels that have dilated, so that our blood pressure will either return back to its normal or be slightly higher than it normally is, just due to the difference in our blood volume.
So a helpful way to think about this is all of a sudden the highway has expanded from like a 1-lane road to like a 4-lane road, but we still have the same number of cars driving on the road. So there's not a lot of traffic. There isn't a ton of congestion. So we have like a low volume of traffic. As people realize that there's more roads or more lanes available, we start getting more and more cars. And then the traffic volume starts to increase, similar to our blood pressure. So that's like another way that you can think about it that may be a little bit easier to understand what is happening with your blood vessels during pregnancy.
So Gina, how are you feeling in your 18th week of pregnancy?
Overall, I'm feeling pretty good. So each week just kind of continues to feel pretty good for me, which I can't complain too much about. We did have our anatomy scan this week. I opted to have it on the earlier side in case there was any issues or we needed any sort of rescan. We had a little bit more time to like react to any sort of like things that we needed to respond to. Fortunately, everything went well. There was no issues. Baby girl is growing great. We know she's a girl. They confirmed that for us. The ultrasound tech did ask us before we even laid down, like, did we want to know baby's sex? And I was like, I already know from the 18 other tests that I have done to figure this out. But that was something that I thought was really nice of her to do because not everybody wants to know what their baby's sex is during pregnancy. Some folks want to wait until they give birth. I like to find out as soon as possible. So she did confirm for us again that it is a girl. I will say that before the anatomy scan, and I'm like this with every ultrasound, I just get a little anxious because of our prior history with loss. We went to an ultrasound and there was nothing there. And so I'm always kind of anticipating that there's going to be something wrong at each ultrasound. And so then it's like a little bit of anxiety like the week leading up. But it's also reassuring for me to be able to see baby and to see that she's doing well. So it's kind of like this like double-edged sword where I'm feeling more anxious, but then it's also like brings a lot of relief like when I finally go to the ultrasound. And I guess I would rather know if there was something wrong. But was feeling a little bit anxious before it. After the ultrasound or during it, I felt really good. My whole family, all the kids were there. My husband was there. And it was this whole family event. And then we also confirmed with our hospital-based clinic that they are going to be our secondary care for our home birth, which is really cool. So planning to give birth at home, but if for whatever reason I risk kind of home birth or I develop a complication where it would be safer for me to be in the hospital, it's good to know that I do have a backup hospital and clinic that I've already established care in a relationship with during my pregnancy. And so they're just going to let me come and do all my labs to kind of maintain care with them. I'm already really familiar with all the midwives because I've support births at that hospital, so I know all of them. And so I have a good relationship with them. But hopefully I don't have to see them at my birth. As much as I like them, I would like to give birth at home. But it did feel really good to have this secondary care established and something that was really important to me and to my husband to have that backup care just in case we needed a little bit higher level of care than giving birth at home. During the ultrasound, baby girl was breech at the beginning, and then she flipped and was head down by the end. So she's doing like somersaults in there right now. I'm not super concerned like what her position is right now, whether she's head down or breech, because it's really early and there's obviously like she's flipping all over the place in there. When I get closer to like my third trimester, I'll be a little bit more deliberate with like thinking about positioning and helping her be in a head down position. And then also like focusing on releasing tension so her path to rotate is clear. I'm already doing a lot of those exercises now to kind of prepare my body for birth, but I won't be like super focused on her specific position until closer to my third trimester. We also found out that my placenta is posterior, which was nice because that means I'm going to be able to feel her kind of moving around a lot more, which will be really reassuring for me. My second pregnancy was an anterior placenta, so it almost felt like my son's movements were like muted. Like I just didn't feel him quite as much. While like all my girl pregnancies, I've had posterior placentas and I've felt these girls like flipping all over the place. And you can even like see their like little limbs moving. I haven't had that yet with this pregnancy. But it was nice to know like where my placenta was, so I have expectations of like how I may be feeling baby, and also that it's really far from my cervix, which was really reassuring. During my second pregnancy, my placenta was low-lying at the 18-week ultrasound, and it resolved like within 2 or 3 weeks, but it kind of was a little bit anxiety producing at that point because it's like, well, what if it doesn't move? And this produces a complication for like my birth to where like maybe I can't have a vaginal birth. And so just knowing that it's as far away as possible was like wonderful at that point. So for whatever reason, your placenta is low-lying at your anatomy scan, or even you have like a partial placenta previa where it's kind of covering the cervix. Typically, most of these placentas, as the uterus grows, where it attached will move away from the cervix as well. So I think like over 95% of low-lying placentas will resolve. You usually don't need to modify exercise quite yet at like an 18-week ultrasound. But if you feel more comfortable, like minimizing movements, especially like deep squats and stuff, that would be fine. Definitely avoiding anything that causes any sort of like cramping. And then obviously if there's any bleeding, obviously don't exercise at that point. But if your provider gives you any recommendations based on like a low-lying placenta or placenta previa at your anatomy scan, you can always ask for a repeat ultrasound like in a few weeks to see if that placenta has moved away so that you can resume your normal activity. So overall, feeling pretty good in week 18 of my pregnancy. Hopefully this maintains the whole time. Normally at this point, I'm having like a little bit of pelvic girdle pain because I'm starting to get like a little lazy with my workouts, but I've been able to maintain them. So I'm feeling pretty good in my body as well. Just we'll see in a few weeks how I'm feeling. But hopefully this video was helpful for you and you have an idea of what's going on with your baby, what you could expect for yourself, especially symptom-wise, what you could expect at your prenatal appointments, and hopefully you're also feeling pretty good as well. So let us know how you're doing in your 18th week of pregnancy because we would love to connect with you on this journey. If you want more support from us throughout your pregnancy, be sure to check out our online prenatal fitness programs and online childbirth education course and our Pellet for Prep for Birth course. You can bundle all these courses together to save 15%, but we want to help you feel confident as you move throughout your pregnancy, as you navigate your pregnancy to figure out what options you want for your birth, and then also help to prepare your body for a really transformative moment of your life. So thanks so much for watching. We'll see you next week.